As you all know, that the International Forum for Promoting Homeopathy has started its journey some 1,426 days back by a group of homeopathic lovers, and later homeopathic doctors and students joined with them. And it was the time of COVID, and so there was no possibility of communicating one another or contacting one another or sitting together having 4 sessions. But in the time we began the sessions, and we have doctors from 65 countries presented various sessions in this forum, and not only doctors but all the eminent personalities from public figures are also joined at the session. And we have 3 sessions every day, 7 to 8 the Hindi session that is just over, and 8 to 9 we have international session in English, and 9 to 10 we have a local language session in Malayalam. All the sessions are going well, and on August 23rd we are celebrating our 500 day celebration of our Hinduism. And anyway, let us go back to today's session, today's proceeding. And our guest of the day is Dr. Vaidehi Kumari Gupta, MD Homeopathy. She has presented so many sessions in our forum. All the presentations were really excellent and different. On all the presentations were also from different subjects. That is also the beauty of her presentation. She is working as the medical officer at the Department of Homeopathy at Bihar, West Jamapuram, and Bihar State. And she was the former assistant professor, Department of Practice of Medicine, Dr. R.B. Singhaya Homeopathic Medical College and Hospital, Bihar. And one of the best subjects to be discussed today, we all know that the immune has a certain thing to do with homeopathy. And what are the things we can observe in those moon phases? So the subject is impact of moon in homeopathy. Let us welcome our beloved guest, Dr. Vaidehi Gupta, to this session. Welcome, Doctor.
Thank you, sir. Thank you for such a warm welcome, and thank you for the appreciation. And thank you, IFPH, for giving me such a wonderful platform. I'm just sharing my screen.
Yes. Yes, we can see.
Is it visible?
Yes, everything fine.
Okay. So today's topic is impact of moon in homeopathy. Introduction. The moon has been known to have major influence on human health. No matter whether it's a physical influence or the mental influence, it used to affect human health. For centuries, the moon and how it affects human behavior has been at the center of mythology and folklore around the world. So moon is always mysterious. Like a person is affected from the effect of moon, different phases of moon. So it was always a people were quite curious about it. It is always in interest, how it is affecting all these things. The Hindu, Islamic, and partially the Hebrew calendar use the lunar cycles. So many religions have embraced the lunar calendar. In Hinduism, many festivals are in such phases, on full moon or new moon. Also in Islamic, so our life is also revolving around all these phases. In Hinduism, God Chandra embodies the movement and changing phases of moon and is closely aligned with periods of sickness and health. In short, Lord Chandra is all about sickness and health. As the different phases of moon changes, the health is altered. That one was about mythology, about religious aspect, but scientifically, the thing is the gravitational pull. The gravitational pull created by the moon causes oceans to bulge. When the earth and moon, in between that phase, during full moon, there is a gravitational pull, and the shaded area, that is sea, it used to attract it toward the moon. It will be slightly bulged in both sides, that is called tidal bulge. There will be two tidal bulges in both sides of the earth first one will be the closest to the moon and the second one will be the farthest to the moon. That's why high tides are produced. So bulges on the ocean surface cause high tides to two main regions of the earth, and the two regions are the closest one and other side, that is the farthest one. That which simply explains why water is affected by moon phases. And this thing is also happen in human body, because our bodies are made up of about 20% of water. That's why it is also impacted by the moon's gravitational pull. So body is made up of 70% of water, and this is affected by the gravitational pull by the different phases of moon. The lunar cycle has an impact on human reproduction like fertility, menstruation or birth rate. The most fertile reproductive cycle has the same length as the lunar cycle and is an intriguing biological coincidence. Like almost the menstrual cycle and the lunar cycle is quite similar, and the length is same. Women whose cycles approach the 29.5-day span, that is the exact lunar cycle phase, has the highest likelihood of fertile cycle, while women whose cycles become longer or shorter have a proportionately diminishing incidence of fertile cycles. Like those women whose menstrual cycle is of exact length of lunar cycle, that is 29.5 or say near this phase, they are most fertile, and comparison to those women who have a comparatively longer or shorter cycle. So when it coincides with the lunar cycle, they are more fertile than other women. The word menstruation is etymologically related to moon. The term menstruation and menses are derived from mensis, which is a Latin word that means month. Also, which in turn relates to the Greek word mean, that means moon. So menstruation, menses, month, moon, all are interrelatable. So menstruation is quite related to the word moon because its origin is from the word moon, and it is quite related to all these things. Lunar cycle also affect mental ailments like depression, epilepsy and psychosis. Epilepsy is quite common, people see like during these phases, like on new moon or full moon, these attacks are more prominent. Also depression, like in antimproved psychosis, these things are present. Also admittance to hospitals and emergency units because of various causes like cardiovascular and acute coronary events, these cases increases. Like hemorrhage is flow of blood is 90% water. Again water, because of the content is water, it is affected from the phases of moon. Diarrhea, again loss of water, it is also affected from the phases of moon. Urinary retention, so all these events are affected due to different moon phases. Events associated with human behavior such as traffic accidents, crimes, suicides appear to be influenced by the lunar cycle. Like all these violent things or the different anything which is related to violence, anger is more prominent during these phases. In fact, in many countries during these phases, cops or police are more active because chances of crimes of being that will be happen on new moon or full moon is quite more in comparison to other days of the calendar. The word lunatic, it is also come from it is also related from moon. Lunatic comes from the word luna, which is a Latin word that means moon. So from the belief that changes of the moon causes intermittent insanity, that's why insane people are called lunatic, and it is related to the moon, that's why they are called lunatic. The very word lunacy dates back to the 15th century, when it was believed the moon and its phases could make people become more or less aggressive depending on its place in the lunar cycle. So they are affected from moon, they are affected from the luna, that's why insane people are also called lunatic. Full moon is 100 times brighter than new moon, so they are more brighter, they are more they looks more enlarged during these phases. When the moon takes certain position, it heightens a person is suffering with. Like the light is increasing, it is more visible. Just like that, the complaints are more visible during full moon. If someone is mentally disturbed, he will get little more disturbed than usual on full moon day. If someone is joyful, he will become more joyful. If someone is angry, he will become more angry. So any symptoms that is present, it might aggravate during these phases. So as the phase changes, these complaints will be enhanced or aggravated. Sleep wake cycle. Insomnia on full moon, somnambulism has also lunar effect. So the circadian rhythm is affected. Insomnia, that is loss of sleep, on full moon is very common. It is quite documented, and there were many researches in which it was seen that during full moon people are not that much in deep sleep in comparison to other days. Somnambulism, that is sleepwalk, it is also affected during different moon phases. The vestibular system, which is responsible for balance and can detect gravity, could be affecting sleep and circadian rhythm. The moon could be changing the magnetic field, causing changes in the cryptochromes in the hypothalamus and changing the body clock in that way. Cryptochromes that are secreted from hypothalamus, which is responsible for the sleep cycle and the circadian rhythm, these are affected from the magnetic field of moon. That's why the circadian rhythm is affected, the sleep wake cycle is affected. Melatonin level appear to correlate with the moon and menstrual cycle. So melatonin hormone, which is important for the sleep, it is also related to the moon phase. Melatonin naturally releases at night to calm the body down and prepare it for sleep. This one is normal effect, and during night melatonin level is increased. That's why people can sleep easily. But in different phases of moon, when melatonin is very high, serotonin will be very low. Serotonin is for a feel good hormone that plays a role in controlling our mood and appetite. So this changes, like sudden change in the serotonin, is somewhat responsible for the sleep, and this will be affected in different phases of moon. In a 2013 study, researchers discovered that around the full moon, people have spent 30% less time in NREM sleep, that is non-rapid eye movement sleep or deep sleep, and slept for 20 minutes less during full moon. So they are they do not sleep in that much deep sleep, and also the duration will be decreased. So quality and quantity both are affected during full moon, and there were lots of studies about it. And it's not just about the light, like the light is coming from the window, that's why the person is not sleeping. In fact, there were also some researches in which these researches were taken in a closed room, and still the result is same, almost same. So it is well proven that during full moon people are unable to sleep, and insomnia is very common during full moon. Warm affections are most troublesome at the full moon, and that diminishes more or less during the waning moon. Means during full moon, warm affections are very much troublesome. Person will be very much affected from warm affection. And during waning moon, means when the moon is decreasing from full moon to new moon, the moon will decrease. That is called waning moon. So as the moon decreases, the complaint will also decreases. This is also seen. And why does it happen? So higher parasite activity is linked to the full moon. This is because the circadian rhythm in the body reacts to changes in the moon's cycle. In accordance with the circadian rhythm, parasites are more active and reproducing. As in human being, the reproduction is affected by lunar cycle. Just like that, the production of parasites are also affected from the lunar cycle. So during these phases, the reproduction of these parasites are more. So the complaints are more, and people are more affected during full moon by the worms. Phases of moon. There are 8 phases of moon. Coming from new moon to full moon, it slightly increases. In starting days, it is new moon. Then there will be waxing crescent, which is a crescent shaped structure. Then first quarter, then waxing gibbous, and full moon. This is increasing phase. and after that, or the waxing phase, and after that there will be decreasing phase or waning phase, that is waning gibbous, then third quarter and waning crescent, and ultimately new moon, and this cycle will continue again and again. This thing is important in, especially in homeopathy, because in repertory there are many rubric with moon, with sub rubrics like new moon, full moon, waning moon, third quarter, first quarter. It is mentioned everywhere, like in BTPB, in Fatak repertory, also in Boga repertory, times, remedies and moon phases. 4 phases: new moon, first quarter, full moon, and third quarter is mentioned, and different medicines are mentioned under these 4 categories. So these phases are also important, and we should know all these phases. In Organon, section 11, 6th edition, in footnote 2, it is mentioned, what is dynamic influence, dynamic power? Our earth, by virtue of a hidden visible energy, carries the moon around her in 28 days and several hours. So earth is quite affected by moon, human body is quite affected by moon, by the dynamic influence or dynamic power, which is a invisible energy, and our life is affected from this moon cycle, from this lunar cycle, and it is mentioned in Organ of Medicine. Moon phases, Materia Medica, and rubrics. There are some medicine in Allen Materia Medica and Boga Materia Medica. New moon and full moon. 4 medicine are common in new moon as well as full moon, like alumina, crocus, salacia, and sabadilla. They have aggravation both during new moon and full moon. Some medicine have aggravation in both phases. Some medicines have aggravation just in new moon. Some medicines have aggravation in full moon. Some medicines have aggravation before full moon or after full moon, before new moon or after new moon. So these are different aspects of the medicine. So alumina, skin symptoms reappear in new moon as well as in full moon. Crocus, menses, discharge of blood. This complaint is also aggravated in new moon as well as full moon. Salacia, head complaints aggravates. This is also present in new moon and full moon. And sabadilla, in generalities it is mentioned, many symptoms reappear. So these 4 medicine, alumina, crocus, salacia, and sabadilla, this is common in both phases, new moon and full moon. There will be aggravation, while in calibrom there is epilepsy at new moon. In sulfur, it is written in Allen keynote, menorrhagia has not been well since last miscarriage, a single dose at new moon, and it is suggested by Lippi that when a lady is suffering from menorrhagia and after her last miscarriage she has not been well since that phase and the complaint is menorrhagia, then a single dose of sulfur is given at new moon. It is mentioned in Allen keynote and suggested by Lippi. Likewise, in full moon, the aggravation is about enuresis in sorinum. In sorinum, enuresis during full moon, that is bedwetting. And calcarea carb, a skin follicular tumor recurring every 4 weeks at full moon. So in calcarea carb, a skin complaint is aggravated at full moon. It is also mentioned in boric materia medica that in calcarea carb there is aggravation in full moon. Cuprum mate, epilepsy aggravated about new moon. They are not exactly at new moon, they are about new moon, like near that phase. In clematis, before the full moon and after full moon, like there are 2 phases. The painful non-itching tetry eruption over entire body, it is common in both things, in increasing moon as well as decreasing moon or the waning moon, but there is a difference. In increasing moon, that is waxing moon, the color will be red and the eruption has moist during this phase, while in clematis it will be dry during the waning moon. So when the moon is increasing, it will be red and moist, and when the moon is decreasing after full moon, it will be dry, that is clematis. Thuja, sexual organ, figwarts on glands, prepuce or female genitals which exude moisture and pus, especially during the increasing moon. So in case of thuja, there will be oozing of moisture from the figwort on glands, prepuce or female genitalia, and it will be during increasing moon, means from new moon to full moon. In iodum, acts best in goiter when given after full moon or when the moon is waning, and it is again suggested by Lippi. It is also mentioned in Allen keynote that iodine medicine should be given in case of goiter at full moon or after full moon or after the moon is waning. Both are same thing. Like we can say it after full moon or the moon is waning, that is the moon is decreasing. In that case, iodine should be given. And anti-include sentimental mood in the moonlight, especially aesthetic love. There are two type of rubric. First, phase of moon, and the second one is moonlight. Moonlight rubric is also common in many repertories. So that there is aggravation in moonlight or emulation in moonlight. So anti-include, there is aggravation in moonlight, and this thing is quite common in every Materia Medica, in every repertory. This thing is mentioned: moonlight aggravation, anti-include. Now talking about repertory, in Kent repertory, the rubric is genitalia, female menses, new moon, and the medicine is Rustux. So when in new moon there is aggravation in menses, the complaint will be aggravated. Then the medicine is Rustux. And in case of otalgia, ear pain, full moon during, the medicine is Silesia. There are three grades: grade 1 in red, grade 2 in blue, and grade 3 in black. And these medicines are of moonlight. There might be aggravation in moonlight or emulation in moonlight. So the rubric is mind, ecstasy, walking in moonlight, anti-include, mind, aggravation in moonlight, anti-include, belladonna, thuja, mind, sentimental, moonlight in anti-include, eye, moonlight emulation, eye symptom, autumn met, vision, moonlight emulation, autumn met, generalities, moonlight aggravation, anti-include, helleborus, and thuja. So whenever there is aggravation in moonlight, anti-include is common in every rubric, and when there is amelioration, the medicine is autumn. It is in eye complaint, it is in vision complaint. So aggravation, anti-include is common in all rubric, and in amelioration, autumn is common, and it is related to eye complaint. In BTPB, the chapter is aggravation and amelioration in general, where moon rubric is given. And in new moon aggravation in it, alumina is also present in full moon aggravation. So alumina is quite common in both places, because it is mentioned in also in Materia Medica, like Allen Materia Medica and Boga Materia Medica, that the complaint will be aggravated in new moon as well as full moon in case of alumina. So new moon, alumina, skin symptoms reappear, and this symptoms present in new moon, aggravated in new moon as well as in full moon. So alumina is common in both phases. New moon, alumina, ammonium carb, calcarea carb, causticum, cuprum, lyco, sabadilla, sepia, silesia. Again, sabadilla is also common in new moon and full moon, because in sabadilla also the aggravation is present in both phases. So sabadilla, generalities, many symptoms aggravate, and it is there is aggravation of sabadilla in both phases. So alumina and sabadilla, it is common in both phases, in new moon as well as full moon in BTPB. And in full moon aggravation, alumina, calcarea carb, cyclamen, graphitis, natrium carb, sabadilla, sepia, silesia, spongia, and sulfur. Again, moonlight and aggravation, anti-include, which is quite common in all repertories. Moon waning aggravation, that is decreasing moon. Here moon waning aggravation is Dalkamara. Phatak repertory. Phatak repertory has many rubrics, and it is quite elaborated with full on explanation. So in Phatak repertory, when we talk about new moon, a skin complaint aggravated alumina. Same thing, that alumina is present in new moon as well as in full moon. In full moon also a skin complaint aggravates, and the medicine is alumina. So this thing is common in BTPB, in Phatak repertory, in Boga Materia Medica. And mentions aggravation, medicine is crocus. It is also common in both phases, new moon as well as full moon. So crocus is present. Crocus menses discharge of blood. Aggravation is in new moon as well as in full moon. So this thing is again here. General aggravation by new moon, Castricum, cuprum, calibrum, nux vomica, rustux, sabadilla, sepia and salacia. Again sabadilla is also here as well as in full moon. And now in full moon, skin aggravation alumina, menses aggravation crocus, asthma aggravation spongia, bedwetting sina or sorinum, and also in BBCR bedwetting as enuresis, it is mentioned in sorinum. Ear stopped graphitis, general aggravation alumina, grania, calcarea, sina, cuprum, lyco, nux vomica, phosphorus, sabadilla, salacia, sulfur, and every alternate full moon aggravation syphilinum. All these complaints are on everything, like on every new moon or every full moon, but the last rubric every alternate full moon, that is important. And the medicine is syphilinum, like at one full moon the complaint will be aggravated, but on next one there will be no problem, and again on the third full moon again the complaint will be aggravated. So on every alternate full moon the complaint will be aggravated, then the medicine will be syphilinum. In first quarter aggravation arsenic, brania, natrium mu. In last quarter aggravation lycopodium and sepia. In increasing aggravation, like when the moon is waxing, increasing, the medicine will be thuja. In boric it is written for thuja, complaints from moonlight. So from moonlight complaint, there will be complaint and the medicine is thuja. In waning aggravation, like when the moon is decreasing, the medicine will be daphne indica. Moonlight aggravation, moon and emulation. Moonlight, eyes, emulation, aurum. Again it was also mentioned in Kent repertory, like eye complaint will be relieved and the medicine will be aurum. Aggravation, antimptard, sepia, sulfur, thuja, emulation, aurum, and blindness, belladonna. When it is mentioned blindness of by moonlight, the medicine will be belladonna, or the loss of sight, belladonna. Synthesis repertory. In synthesis repertory, new moon, generals, convulsion, moon, new moon convulsion, bufo, castricum, cuprum med. So when the convulsion will be in new moon, medicine will be bufo, castricum and cuprum med, and when the convulsion will be in full moon, medicine will be calcarea ka natrium mu. Ear pain or otalgia, full moon during salacia. So when there will be otalgia or the ear pain in full moon, the medicine is salacia. It is also mentioned in Kent repertory, ear pain, full moon during salacia. So these things are common in both these repertories. Moonlight aggravation, mind sentimental, moonlight in, medicine is antimcrude, ignatia, vanilla, and vision, loss of vision, moonlight, belladonna. Again, in phatic repertory, the rubric was moonlight, blindness, belladonna. So here also in phatic repertory there is blindness by moonlight, the medicine is belladonna, and also in synthesis repertory, loss of vision, moonlight, belladonna. This is common. Complete repertory, in new moon, generalities, it is mentioned in generalities, moon aggravation, new moon, medicines are arsenic, nux vomica, phosphorus, pulsatilla, rustux, sabadilla, salacia and sulfur. And there is nothing mentioned about the full moon phase. In BBCR, although in the Materia Medica phase I mentioned those phases of new moon and full moon, and in repertory portion those rubrics were from the Materia Medica portion. In repertory portion it is mentioned for just two rubrics of cough and mind. So new moon, cough in new moon, medicine is sabadilla and salacia, and cough in full moon, the medicine is sabadilla. So sabadilla is common in both phases, new moon and full moon. Mind dull, stupefied, medicine in full moon, medicine is sulfur, and mind dull, stupefied in moonlight, medicine is antimcrude. So antimcrude is common in every phases by aggravation of moonlight. The times of remedies of and moon phases. It is a book written by Dr. C.M. Boger. It is a combination of two books, The Times of Remedies and Moon Phases. So Dr. C.M. Boger, Cyrus Maxwell Boger, emphasized the importance of time factor and moon phases in the action of drugs. Like in times remedies, more the impact were given on the time, and and in moon phases more impact was given on the different phases of moon. He observed that the periods of modalities are very frequently related to the moon phases, like their aggravation or emulation in different phases of moon is quite prominent. He noticed that the remedies as well as the patients both showed period of aggravation and amelioration in a very definite relation to the lunar movement. So lunar movement means the phases of moon is quite responsible for the aggravation of amelioration in many medicines. And then he wrote down all these things, and those medicines which were their successful treatment, he mentioned those cases, and he mentioned those medicines in the book of Moon Phases. Homeopathic remedies act in the various phases of moon, like first quarter, full moon, last quarter, and new moon. So there are 4 columns in the book in the times, remedies and moon phases, and there is a list of medicine. Then 4 columns of first quarter, full moon, last quarter, and new moon, and all the successful prescription is mentioned in those 4 categories. So normally there are 8 phases, but in moon phases 4 phases are considered: new moon, first quarter, full moon, and third quarter. Moon phases. It is published by Dr. C.M. Bogle in year 1931, along with the times of remedies as the times of remedies and moon phases. So it is a combined book. Total number of remedies 186. Number of grades 3 grades. He emphasized the importance of moon phases in the action of a drug. There is a table. The table consists of an enumeration of time at which a particularly successful prescription has been made, thereby accentuating the importance of the time period in which the remedy has been found more useful. He made a list, he made a table of his successful prescription, and he mentioned all those things in that column, like at which phase the medicine was more effective, and he marked it. Whenever a patient reported with a striking relief in the symptoms, the time was marked in the phase of moon. Like Pulsar was he, like if he prescribed Pulsar to a person, and he told him that during this phase, while giving at this phase, they were quite relief or aggravation and all. So it was mentioned in this book that at that phase it was the most successful prescription, and it is mentioned in numbers, like how much successful patients were there. Utility, how to use it. When a new patient comes to you, you ask him, when are you worst, like which was the worst condition, like for the aggravation phase, and the patient will say, well, I was worst in the middle of last week. Then open up your almanac and see what quarter the moon was in. Like if the person is telling you about a certain date that at that time I was worse, then look at the calendar and see what was the phase of the moon, like whether it is a full moon or new moon, first quarter or third quarter, and then you have to look according to that thing. Then look down your list of remedies and see which remedies are most prominent in that quarter. So in that phase, which medicine is more prominent, then it can be prescribed on the basis of the phases of moon. This is a single page of moon phases, where there is a list of medicine in the left, extreme left. Then there are 4 phases: new moon, first quarter, full moon, and last quarter. Like we can see in the case of arsenic, the total successful prescription in new moon of arsenic is 22, in first quarter 30, full moon 19, and last quarter 15. So the maximum one is 30 in first quarter, and then it is decreasing from 30 to 19 till 15. So in last quarter it is least, and in first quarter it is the highest. So in arsenic, highest number in the first quarter, that is 30. It stops abruptly in the quarter of the full moon and falls off then to the lowest point, and suddenly it is decreasing, like from 30 it is 19, then it is 15. So most successful thing is giving arsenic in first quarter of the phase. Like in case of aconite, in new moon it is 0, first quarter 3, full moon 3, last quarter 0. So it is quite in equal situation, like equinety is effective in first quarter as well as in full moon, but it is not like it is on in same situation. While in Aeschylus we can see in new moon it is 0, first quarter 1, full moon 2, and last quarter 0. So we can say that in according to that repertory, Aeschylus is more effective during full moon in comparison to all other phases. And like in Agaricus, new moon has 4, first quarter 0, full moon 3, and last quarter 1. So we can say that Agaricus is more effective to give during new moon phase. So it is just a guideline to prescribe according to the different phases of moon. Now in sulfur, just like that, again the same list of medicine, and 4 phases: new moon, first quarter, full moon, and last quarter. In phosphorus, new moon, the successful prescription are 21, first quarter 20, full moon 51, last quarter 32. So we can say that phosphorus is most effective during full moon, that is 51, which is the highest one in the entire book. So phosphorus 51 successful prescription prescribed in the week of the full moon, and it is the highest one, the 51. And the next most prominent is in last quarter, which shows a decline. So after 51, although it is second highest, but there is a decline. So 21, 20, 51, 32, like most effective during full moon, and less effective, slightly less effective in last quarter, then more less in new moon, and in the least effective in the first quarter. Another medicine that is made from the moon rays medicine is Luna. There are 2 ways to make this medicine. First one is Fink method, and the second one is Higgins method. Fink method, Fink took sugar of milk and exposed it on a glass plate to the moon's rays and stirred with a glass rod. Meanwhile, the sugar of milk so charged is dynamite in the usual way. So sugar of milk is taken in a glass plate and it is kept in the moon rays, and it is stirred with a glass rod, and that will be charged, that will be dynamized by the effect of moon rays, by the effect of the dynamic property of moon, and the medicine is Luna. And the second method, in Higgins method, he made a prescription by exposing pure water to the moon rays for 3 or 4 hours in South America, and then dynamizing the water so charged. Thing is same. In earlier case, Fink took sugar of milk. He is taking pure water and keeping it into for 3 to 4 hours in moon rays, and it also have that dynamic effect. So there are 2 ways to prepare Luna: by sugar of milk or by taking pure water. Again, moon is mentioned in Materia Medica as a common name, moon seed. Actual name of the medicine is Menispermum canadense, and its common name is moon seed. The seed inside the berry resembles a crescent moon and is responsible for the common name. So in the lower structure we can see the crescent seed. It is a moon like the grey structure. It is in a shape of moon. That's why the seed is in a shape of moon. That's why this plant is called moon seed. In above the seed portion there is fruit which looks like grapes. The plant whose leaves also looks like grapes, so it is quite similar to the grape plant, but there is a difference. Both the leaves and fruit resemble those of grapes. Confusion can be dangerous as moon seed fruits is poisonous. Grapes plant is not poisonous, although they are quite similar in the appearance of the leaves and the fruits, but the grapes plant is not poisonous, but moon seed plant is poisonous. So moon seed, again moon is here because of the crescent shape of the seed, that is Menispermum canadense. Next one is Spongia Luna treatment. Like while making spongia and prescribing spongia, there is a rule of moon here also. So that's what is called Spongia Luna treatment. The method is cut slices of sponge of the size of a finger. So the sponge, because spongia belongs to porifera group, the sponge group. So cut the sponge of the size of finger, grill them at candle flame till they are brittle at the center but still elastic at the border. So it will be grilled on a candle flame such like that it will be brittle at the center and it will be soft and elastic at the border. Titrate the whole and put 7 or 8 gram into half a liter of rainwater or river water. So after grilling that sponge, it will be triturated in mortar and pestle, and after titration, 7 to 8 gram of the portion is taken and it is mixed in half a liter of rainwater, that is purest form of water. So rainwater or river water, the bottling must be done 3 days before the new moon, and it will be done like it will be mixed in half liter of water just 3 days prior to new moon. Close the bottle and put it in a cellar. The bottle will be kept in a cellar or basement, taking care to shake it once every day, and it should be shaked every day. And 3 days before the full moon, the medicine will be kept during 3 days before new moon, and the medicine will be prescribed 3 days before the full moon. So 3 days before the full moon, the patient commences to take a tablespoon night and morning. So it will be taken a tablespoon twice a day 3 days before full moon. The greater part of the bottle will be finished during the waning moon, and after that most of the medicine will be emptied during the waning moon, that is the decreasing moon. So the medicine was prepared before new moon, the medicine was taken before full moon, and the bottle will be almost will become empty during waning moon phase. So most of the medicine will be taken around full moon phase. That's why spongia is one of the remedies having aggravation at full moon, and it is seen that in spongia the aggravation is at full moon. Like in BTPB, moon full aggravation, the medicine is spongia. Also in Phatak repertory, asthma aggravation, spongia. Spongia is well-known medicine for the respiratory complaint, for the asthma complaint. So it is it is mentioned in full moon in Phatak repertory. Full moon, asthma aggravation, spongia is the indicated medicine. So there is aggravation in full moon in the spongia because of that spongia luna treatment. References. The references are Organ of Medicine by Dr. Samuel Hahnemann, Bogus, Times of Remedies and Moon Phases, S.K. Tiwari, Essential of Repertization, BBCR, Allen's Keynote, Boric Materia Medica, Synthesis Repertory, Complete Repertory, Radar version 10, and Internet of course. Thank you for your time.
Thank you, Dr. Vaidehi, for your excellent session. Really, this is what we can call as a mother of our presentation, because so much of depth in your presentation. You have studied almost every part of the same, and you look into various aspects of each and every remedy to find the difference between how it works before moon, after moon, and how what are the remedies that works during moon, and what are the medicine which have action on both times.
Thank you, sir.
Anyway, it is the time for discussion. I invite all of you to participate in the discussion, and those who want to have a question can raise your hand so that we will allow you to unmute yourself and you can speak. Anybody want to speak? Please raise, or you can ask your question now. We have seen that these medicines works in various conditions, but you have given some specific days or some medicine action of these particular remedies. How will you calculate all those things, and from where you get all those things? on those specific for 22 days, arsenic, so much days, like that.
From the date of aggravation, from the phase of
Yes,
aggravation.
yes, yes. Then whether you prescribe all these moon phases accordingly, or
Yes, sir.
what is your success rate in that presentation?
So it was good. Actually, I was in internship, and I have seen many patients. First time it was in internship. I have seen many patients like in Hindi, Amavasya and Punima. So patient used to be very specific about that phase. That yes, there is aggravation during that phase. They are suffering during Purnima, or they are very much miserable during Amavasya, and they used to strike that thing again. So I have considered these things, and which is quite prominent.
Uh, then now you are practicing in government department, and how much of patients you are getting every day? What are the kind of patients you are getting every day, and how the department support you in all those cases?
Well, so unfortunately, here in the hospital, like it's a PHC, and homeopathic medicine are not available here. So it's quite. I'm not satisfied with these things. Like when I'm studying homeopathy, and I'm pressurized to prescribe those medicines. So it's just initial phase. Like I have joined just 1 week earlier, and I used to write it down on a page of paper and just bring it out from other shop and all. I'm just doing the same
Oh,
thing.
the homeopathic medicine are easily available in
Yes, sir.
Bihar, and there are many shops in Bihar.
Yes,
The
sir.
popularity of homeopathy is much higher in Bihar.
Yes, sir.
That's,
Especially in case of skin complaint and joint complaint, people have great faith on homeopathy because they are
um,
getting bored. They are not that much habitual to take all these medicines again and again in case of joint complaint and skin complaint.
uh, do you know how many homeopathic dispensaries or hospitals are there in government sector in Bihar?
I have no idea.
No idea. You have to search it and find out, because in Kerala, we have more than 1,100 homeopathic dispensary in government sector, and more than 40 government hospitals, and 5 medical college under government sector.
Okay, there's
So that the admission patients admitted and treated are getting much benefit out of homeopathy.
okay. While talking about homeopathic college, there is a single government college in Bihar, that is RBTS, Government Homeopathic Medical College in Hospital Muzaffarpur, and I am student of that college in UG as well as in PG. I am quite lucky about that, and rest are private colleges.
Your presentation looks like a PhD research work. So you just you can go ahead with that method, and you can get PhD on that subject
Thank you,
itself.
sir.
That's
I have
that would
applied for the West Bengal University of Health Sciences, and out of 6 people, I was also selected for PhD. But I have to stay in West Bengal for 5 or 6 years, whatever it may be. I have to work there, and that thing was not better for me,
that's a
so I
big
just came back. But I was selected for
okay.
PhD.
Okay. No need, no need for such things, because you are a person fully dedicated to homeopathy, so you can become one of the famous homeopaths in Bihar if
Yes,
you
sir.
go like this, because the determination to conquer the world is just like that. Only those who are dedicated to this profession, and those who work hard, and those who read again and again, and study more and more into the depth of homeopathy will the winners definitely. And naturally, you are getting practice also in government sector. So whether the private practice allowed to homeopathic doctors in government sector there?
I think yes. I'm
Yes,
quite new
then
here, so
yes,
I'm.
definitely.
Yes, sir.
Definitely, you can start this. I think here what our doctors used to do in the early part of their career, most of the homeopathic dispensary has only very few medicines, but doctors usually purchase medicine from their pocket and they bring there and they give to the patient, and then when they get results more and people come to them, and naturally the patients will start in search of this doctor's home and will visit there, and they may get a good name also. There are government doctors who are having more than 300 patients a day in private sector here.
Yes, sir.
Because they have a very
Fortunately,
good.
these medicines are quite pocket friendly, so patients don't bother about buying these medicines. Like I used to prescribe single medicine, so which is quite cheap, and they used to amaze. Oh, it will just cost 30 rupees or 20 rupees. So they don't bother about it because they have already spent lots of money earlier, like in different years. So
Yes,
they are not
yes.
that much bothered about it.
Now the condition in Kerala is entirely different. We have a bulk of medicines in our almost all hospitals with even mother tinctures, potents, all even the same medicine having different potencies. In the early part, only one medicine with one potency is used to be there. But now things are different. We can get whatever potency, just the medical officer just write to the department and they will give, because there is a big medical pharmacy in under cooperative government sector here, that is Kerala. It is named as Congo, which produces medicine for this government sector also. They used to export medicine from Kerala to a different part of the world also. Now started. You should. The quality of medicine is very good because all these thousand dispensaries, they are using the same medicine only, and most people are getting results also. So anyway, very happy to see you with in the government sector in Bihar. Our Sahani
Yes, sir.
sir and all are there in Bihar.
Yes, sir.
And sir is in Patna, I think. Sahani sir is in Bihar.
Yes, sir. From Patna.
Yes, yes. You are from?
Gaya.
Uh, uh,
Gaya, Bodh
very good distance in between
Um,
both your places.
yes, sir. It is.
It's, I think there are private homeopathy, a lot of private medical homeopathic hospitals there in Bihar.
Yes, sir.
And what about the other homeopaths, in Bihar? All of your friends are having very good practice?
Yes, sir. Like my all batchmates are here. Like in Bihar, there's a reservation for female candidates, and my all batchmates are in government sector right now. Of my batch of
Oh,
BHMS.
female doctors have a special reservation there.
Yes, sir.
How much of reservation? 50% or 30% like
I
that?
think 35%.
Oh, that's good. That's
Actually,
good.
I forgot the figure. I think it was 35%.
But in Kerala, the most of the students, 90% of the students are from female fraternity.
Okay.
That female category. Only 10 to 15, because most of the boys are going for a early earning jobs
Yes, sir.
rather than simply sitting. Only those who are dedicated to these professions are sticking on to our profession, our hobby. Then, anybody want to speak to Dr. Please raise your hand. Dr. Vaidehi Gupta is there. Dr. Boglin, are you there? I invited Dr. Sadat said to say a few words on this presentation. Yes, Dr. Boglin. Yes, please.
I'd like to congratulate our young doctor here, very enthusiastic. I think I agree with you that she has done some new things about the repertory through the moon. So there's something new that I have learned today, and it is a good thing. And like you say, she can do the further research into it, And I think her presentation is very good. Like you said, it is a PhD level research. No, I think that's very good, and I hope that you can share some live cases that which you have used the moon repertory to treat your patient. Anyway, congratulations to Dr. Vaidahi Kumari Gupta. Over to you, Dr. Danesh.
Thank you, sir. I'll try. I'll try to add this thing in my next presentation.
Doctor, please share your mobile number also so that we can add it to our program list so that those people who want to have communication or can also have questions to you.
Sir, I'll text you. I'll text you
Yes,
later. I'll text you later.
yes.
Sure,
Yes.
sir.
Dr. Sadat, Dr. Sadat said, if you are there, please make your comment on this presentation.
Thank you, sir. Thank you, Vaidehi, for the beautiful presentation. And
Thank you, sir.
it's something little, it needs a lot of preparations and a lot of courage to present this kind of pages, classes, because it takes a lot of PG level, and most of the people has to digest it. And homeopathy is going into that line. But practicality is also difficult, and places from BR are doing a wonderful job.
Thank you,
Keep
sir.
doing it. Keep doing it, because we need, future generation needs people like you.
Thank you, sir.
Okay? It was a great presentation.
Thank you, Dr. Said, for such a comment here. Really, everybody loves your presentation. That's what fact. That's a fact. So I invite Dr. Bob Lim to say a vote of thanks to the session also. Please unmute. 1 minute. Please unmute. Okay, please unmute.
Okay. Somebody locked me out for speaking. Okay, thank you, Dr. Danesh. This is the end of the 1427 day of the uninterrupted daily webinar of the International Forum for Promoting Homeopathy on this 28 July Sunday. And on behalf of the IFPH, I would like to express my sincere thanks to Dr. Vaidahi Kumari Gupta, who have presented a very unique repertory according to the moon and the moon phases. I think she did a very good research on it, and I hope that she will continue to research more and share her knowledge with us in the near future. And once again, thank you very much. Over to you, Dr. Danesh.
Thank you, Dr. Bob Lim, and thank you, Dr. Vaidehi Gupta, for such a wonderful presentation. And thanks for those who attended the session also. And tomorrow we will have a session from Dr. Aditya Dilip Kumar Patil, who is an independent researcher and senior research fellow. And the subject will be evaluation of antipathic potencies of homeopathic medicine, insulinum, pancreatinum, and urinum nitricum induced diabetic rat. So that is what tomorrow Doctor will be talking about. So with that, we come to the end of the 1427th day.
Thanks.
That's right. Thank you, Dr. All. We can see you tomorrow at the same time. Goodbye. Over to Dr. P. Shaila to the Malayalam session.